for the day, Sudeshna, and we are here to discuss yet another important topic about the importance of breathing exercises during pregnancy and postpartum. We have an amazing guest speaker with us today. Please welcome Ritu Kumar Singh. She is the founder of Fit Home, Fit Moms, Fitter Homes, who specializes in weight loss and health programs for women. She also shows a lot about prenatal and postnatal exercises, and she is also like India's first certified trainer for repairing diastasis recti. So, Ritu, thanks a lot for joining us today. I'm sure all the information that you'll be sharing with us today will be extremely helpful for our viewers. So, thanks a lot for sparing some time with us today. And let me just introduce our topic to the viewers once again, and then we'll head to the question and answer session. So, today we are talking about the importance of breathing exercises during pregnancy and postpartum. Now, we read a lot about nutrition during pregnancy and postpartum, and prenatal and postnatal exercises, but breathing, which is actually the most crucial aspect to maintaining good health, it's often overlooked and ignored. So let me start with a basic question, Ritu. Why do you think this aspect is so overlooked, and what are the can you like give the viewers an insight into the benefits of breathing exercises, especially during pregnancy?
All right. So, firstly, thank you for having me here, Sudeshna. It's always a pleasure to be here on Baby Chakra and impart knowledge about a topic which is very much ignored. Like you said, most of the times people are aware about the nutritional aspect of pregnancy or postpartum period, but we ignore the most crucial aspect of training our body right for this marathon. So I consider pregnancy plus postpartum period to be a marathon. Marathon is a journey wherein you are running for a long distance. Okay, so it's a long distance period which starts right from pregnancy and it continues till the time your child is at least 5 years old, to be very frank. So when women ask me how many months I'm postpartum, I always tell them ki once a postpartum is always a postpartum and you need to take care of your body all the time, like all your life. So let's understand why what is breath basically. So it's one of the most, not only the crucial, but it's the base, one of the
Yeah.
most basic thing, right? So we can survive without food for few weeks, right? We can survive without water for few days, but we cannot survive without breath for more than a little few seconds, right? Breath is important for us. We need the oxygen flow to go inside our body, and it is a very important and a necessary part for us to survive, right? So breath work is important not only in pregnancy and postpartum, it's important for everyone these days, especially after COVID, the pandemic. But it is more important when a woman gets pregnant and postpartum, because then is the time when there are so many changes happening in the body which directly affects her breathing patterns. So that is the time when she has to get more and more aware about it, right? So let's understand in pregnancy, why do we require breath work? First of all, there are many hormonal changes which are happening. Second, the uterus is growing and it's compressing the lungs, right? So automatically your breathing process becomes very shallow, right? And it becomes very fast and shallow. So women who are watching this, of course, they must have seen ki jaisi the moment they become pregnant, they're huffing and puffing, their breath has become very shallower, their breath has become fast paced, and they're always stressed and everything. So, breath is directly connected to our central nervous system. So, it has two parts, sympathetic and parasympathetic. So, the parasympathetic nervous system is responsible for creating calmness and relaxation in us. While the sympathetic nervous system it's the reason why our flight and fight hormone gets activated and we start feeling very worried and we start getting anxious. So when we are having a very shallow breathing, or we are breathing through our chest, apically breathing, like this, it's going up and down. So that's the time when the flight and fight hormone gets activated. Our brain gets a signal that there is something to worry about, okay? Or vice versa is also true. When we are worrying so much or we are under a stressful situation, automatically our breath becomes shallower as well. So you might have seen whenever somebody is panicking, what is told? They tell, take longer 5 deep breaths, you'll be fine. So that's how breath impacts us as a whole individual, especially our mental health. Now, when we are breathing अच्छे तरीके से, like we are breathing in a 360 breathing, fully expanding and fully exhaling the air out, that's a time which affects the parasympathetic nervous system, which is responsible for calming us down. So that's why when people are doing yoga, right, or they're doing meditation, it's the breath work which is calming them down. So in pregnancy, like I said, due to the changing hormones and the uterus becoming larger than what it is, it compresses the whole process of breathing in a pregnant woman. So at this time, if she focuses more on breathing, then she will be able to develop a better muscle mind connection. And 9 months is a big time. It's a big, it's like a huge journey wherein she is going to carry a baby. The baby is going to grow further. So she needs to be very careful about her breathing pattern, because she can either make it through right breathing or she can break it through right breathing. So most of the postpartum problems which happen are an outcome of wrong breathing done during the pregnancy, or no focus done on on breathing during pregnancy. Also, breath work is very important in the blood circulation, and also letting oxygen supply go to our brain. Okay, so when you are growing a new baby inside your body, the demand of that blood circulation arises. At that time, if you focus on that, of course, you're providing enough oxygen to the fetus as well. So that's why the breath work is also important, and very, very important the labor process. When you are undergoing labor, of course, during that there are three stages of labor. There is early stage, there is an advanced stage, and then the birthing stage which comes. So in these three stages, the contractions comes and go. Okay, so in the initial phase of the labor, the contractions will be smaller and they will come after a long period of gap. But as you go to the extensive labor, when you're about to deliver the baby, the contractions will become bigger, and very painful, with less resting time in between. So if a lady do patterned breathing practices during the pregnancy, she will be much prepared for the labor process. So women who do hypnotic breathing and patterned 360 breathing practices, counting how many times they're inhaling and exhaling, they're more calm and composed during the labor process. And for them, it becomes easy, right? Because they're aware. When are the contractions going to come? So she has to distract herself by a distraction pattern breathing. So that's why breathing exercises are important, so that it becomes a smooth process for her to deliver the baby as well without facing much pain. Now, with regard to the postpartum period, breath work is a foundation stone. Okay, so first of all, most of the women lose connection between their muscle and mind, of course, because of the shallow breathing. And if they have not worked out in pregnancy and not focused on it, then it becomes a necessity for them to start with connection breathing first. So they have to start doing 360 diaphragmatic breathing, so that they are not only able to improve the blood flow supply and oxygen inside their brain, but also they're training the innermost transverse abdominis muscle, right? So that it doesn't become too tight, and they are able to train it, and they are able to also learn to manage intra-abdominal pressure by doing this breath work. Also, breath work done in a rhyming pattern helps them to calm down. And it's very important that, to avoid postpartum depression. So most of the women, they are suffering from postpartum depression. If at the right stage we start the breath work, there are 99% chances that the woman will not face it, because she'll feel calm, she'll feel composed, and she will get that strength to fight it off mentally. So that's it for pregnancy and postpartum.
So, like, would you say that before, after postpartum, some women do tend to get conscious about their body, and they would want to jump right into, hardcore workouts, and to like try their best to go back to their pre-pregnancy weight. So would you recommend to start with the breathing exercises first, and then go to tougher workout sessions, or can they do it side by side?
I always recommend that no matter who you are, no matter where you come from, even if you're an athlete coming up to me as a client, I always tell them that in any case, you have to start with the connection breath work first, no matter what you're doing. All right, because your body is not the same as it was pre-pregnancy. We must understand this. There have been, cases of people, normal, let's say regular people, okay, those who have not even got pregnant or they're not in a postpartum stage. Some people are still shallow breathing. They're breathing, they're apical breathers, they're breathing from their chest, okay, or they're reverse breather, ulta breathing kar rahe hain. And they also, when hit gym, I'm talking about men here, okay, so even men who hit gym and do hardcore workout and they do not know how to breathe properly, they are also the ones who are very susceptible of causing injuries to themselves. Especially they are very easy targets of having hernias and having diastasis recti. So this can happen even to a normal individual who doesn't know how to breathe properly. So in pregnancy, when you have undergone so many changes, and postpartum period, your muscles have become all loosened up and everything because of the relaxin hormone. At that time, you definitely need to breathe first and then switch to the other forms of workouts.
So there's a strong connection. Is there a strong connection between, working on your diastasis recti as well as the breathing exercises, and how is it connected?
So even diastasis or no diastasis, I would recommend starting with breath work, because sometimes the diastasis become grave after some duration of time. I'm dealing with clients who are 3 years postpartum, and they're coming up to me and telling me that they were absolutely fine. Okay, they had no problem there. They did not have any separation of abdominal muscles, but they started seeing a coning now because they have been hitting the gym in a very hardcore manner, right? And probably they were not breathing properly, so this happened with them. So I say that it can happen at any time of the stage. So you, once a postpartum is always a postpartum, so you have to keep looking for those cues, especially focusing on your breath work. Now, diastasis also, breathing is the key. It's the key to that lock which has been done. Okay, so breath work will first calm you down. In most of the cases, I have seen people having diastasis are the ones who are very stressed out. Okay, so that's very evident from the breathing pattern. Any client who has come up to me and I've tested them in the assessment call, their breathing has been either apical, reverse, or very, very shallow. So most of these women are stressed in their life. So of course, for by doing the breathing exercises, they will first calm down. Their body starts getting better. It starts falling in the neutral alignment, and then slowly we can move on to the strength training stage of the work. So of course, it's a very important element in dealing with diastasis recti.
Could you also tell us some important breathing exercises that expecting mums and new mums can try at home
So
to
there is a
improve
very
their health?
basic 360 diaphragmatic breathing, okay, which I say that everybody must be doing. So diaphragm is a muscle, okay, which is responsible for breathing, okay. So all you have to do is when you inhale, so you have to put your. It's like I need time to explain it in a very crucial manner. I keep sharing stuff on my page, Fit Moms Fitter Homes, and my personal account as well. So you are not supposed to breathe from your chest, and you keep hands on your ribs, you inhale and you focus on the expansion into the rib cage, so that your ribs, when you inhale, they go out and expand and up, and the all the air which comes in, that expands in a 360-degree. So there is no forward force into the body, expansion in 360, so the air goes even to the front, sides and back, and when you exhale, you're focusing on the ribs coming together and down. Okay, so it's like, so it's a 360-degree expansion. If I describe it in this, like let's say I'm standing sideways, or this is the muscles I'm talking about, the transverse muscle and all abdominal muscles. So when you inhale, this is what happens, they're expanding in a 360-degree, and when you exhale, this is a very basic breathing which anybody can do, right? So we are basically focusing on expansion on the rib cage and contracting it, right? So most of the time I see people breathing by watching YouTube, and in the name of diaphragmatic breathing, they're teaching the apical breathing, wherein the force is just forward and backward. So what people are doing is, this is what they're doing, they're pushing the bellies out and pushing the bellies in, which is basically creating and disturbing the abdominal pressure and making it in very excessive, which is also one of the causes for women developing hernia past having diastasis recti, because there is a forceful forward motion like that done in kapalbhati. So we have to start with gentle diaphragmatic breathing. This is the very basic. Now we have to incorporate this breathing into the daily workouts only. So apart from that, I also teach two-step exhalations of 360 breathing. Like you inhale, then you exhale in two steps. Okay, so this is a two-step exhalation which I teach. Then there are many advanced form of working out, like I teach them elevators, doing contractions, how to do that, the deep abdominal exercises. And but that takes time, because first they have to build up the muscle mind connection by doing 360-degree breathing correctly. So I have seen it takes around 4 to 6 weeks for my clients to understand and start doing only 360 breathing. It looks easy when I demonstrate and tell how to do 360 breathing, but when you start doing it, there are so many problems which happen. Like people breathe like this. So even if they put their hands on their ribs, they contract their shoulders. They're using their accessory muscles of their shoulders. I see people doing like this, pushing their neck forward. So their core is so weak, or they're contracting their legs, they're squeezing their hips. So their core are so weak that it is seeking support of all accessory muscles to do the breathing. So there has to be an overall work done. And apart from breathing, they also have to focus on getting their bodies into neutral alignment. Because most of the time the rib cage are not stacked over pelvis, it's either like this or like this. So that's a holistic work which has to be done. In any case, if I would have to advise to start doing something, I would say start with 360-degree diaphragmatic breathing, and not just the forward belly breathing of pushing it forward and back.
I guess how you rightly said, the mind muscle connection matters. I think breathing is the most crucial aspect, and I'm glad that we could, connect today and bring this awareness to moms, because not a lot of people talk about this breathing, the importance of breath work during pregnancy and postpartum, how you have started on your page. So I would just like to end our discussion here and ask you if you have any other like helpful tips for moms that you would like to share from your experience.
See, so the most important tip I would like to share with everyone is that slow down. Okay, so most of the times we see those pictures on flowery pictures on Instagram of those celebrities who have lost their weight immediately after pregnancy, or of any other influencer or any other person, or maybe your next door friend who lost weight very easily. So I want you to just slow down. You are the person who decided to become mother, and you must understand that your body has gone through a lot of it, right? And you need to bring it back to shape slowly. So enjoy motherhood, love your baby as much as you can, and spend time with them, cuddle them, feed them, go for a walk if you have to, a very easy walk, not a brisk walk. I would say don't start have to lose weight and all that. If you will lose weight eventually at the end of the day, so calm down and go easy with yourself with regards to diet or anything. Enjoy this lovely phase, because your child will grow and you will not even realize when they have grown, right? So don't jump into too much of a cardio, or don't jump into too much of heavy weight lifting unless you have been cleared by your doctor for diastasis or umbilical hernia, or you're facing any pains, or you're leaking urine and all. One very important tip I want every woman to follow is that I want them to stand a bare belly in the front of mirror, no matter how their belly looks, okay? And always just pay gratitude to your body. So stand in front of the mirror, no matter what view you are getting, and just say, I thank you. I thank you, my body. I thank you, my belly, for bringing me where you are. You have undergone a lot of it. You are the one who's responsible for giving me a beautiful baby or babies. Had you not gone with so much of trauma, I wouldn't have been a mother today. I want to thank you, and I'm fully grateful for who you are and how you look today. And I promise you that with all patience, calmness, and love, I'm going to give you what you need. I'm going to bounce you back with all caution and precaution. So if every mother talks like this to herself, I'm telling you it's going to bring a lot of positive change. Because most of the time women are like, I look very bad. Look at my past pictures. I was so slim and sexy. And look at me now. मेरा पेट इतना गंदा दिखता है. छी मेरा पेट कितना गंदा हो गया. So never talk such negative talks with yourself. Talk positive and trust me, your body is going to reward yourself अपने आप ही.
Thank you so much for sharing so many helpful tips. I think our audience would have, taken a lot of important aspects from our discussion today. And to our audience, I would like to say, please go and follow Ritu. She has two pages on Instagram. You can follow her on Fit Moms, Fitter Homes, and her personal page as well. We'll link both the IDs in the description box below. And once again, thank you so much, Ritu, for coming to Baby Chakra today and, holding this discussion with us. So, with this, I would like to end our live session today. Thank you everyone for joining, and please follow Baby Chakra. We will be back with more parenting. And okay, so we have a question. I just saw it right now. Sneha is asking us: Is pregnancy possible after umbilical hernia surgery?
Doctors do not recommend that. And see, if you, what kind of an umbilical hernia surgery you had? Did you have a mesh put inside? Can you please
Uh,
answer me? If she has to first answer. She has a
yeah.
mesh. You know, in the umbilical hernia surgery, sometimes they stitch it, or sometimes they put an artificial mesh in place of the connective tissue. So
She just answered yes, so I think she had a.
I think she has a mesh put inside, and the right person to answer it would be her surgeon in this regard. Okay, so because no matter whatever happens, in any case, the muscles are going to open up again. The mesh may break again. So usually the doctors do not recommend having pregnancy after an umbilical hernia surgery. Usually they tell the clients only this, or the patients this, that get your babies delivered and then get a surgery done. This is what they say once and for all. So I think, Sneha, please ask your doctor. I think the best person to answer this would be your surgeon or your doctor, whosoever you're consulting.
Okay, so yeah, that's all for today. Please stay tuned for more parenting and lifestyle videos, and do follow Ritu's page on Instagram. Thank you so much, Ritu.
Thank you for having me.
Yeah, bye everyone. Bye.